is Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.
Hello and welcome to Your Health. I'm Barry Morgan. When it comes to breast cancer research, Dr. Mark Basik is a leader in his field. Dr. Basik has been leading an international effort to study treating breast cancer without surgery. He and his team have also made a discovery that could open the door to new therapies for overcoming drug resistance. Dr. Basik is a surgical oncologist and medical director of the Interdisciplinary Breast Cancer Team at the Segal Cancer Centre at the Jewish General Hospital, as well as senior investigator at the Lady Davis Institute, the research arm of the Jewish General Hospital, member of CIUSSS West Central Montreal. Dr. Basik, first of all, thank you so much for joining us.
Thank you for the invite, Mary.
Absolutely. Let's begin with treating breast cancer without surgery. This is fascinating. How would that be possible?
It's actually not a new idea. It's been going on for a long time. We just haven't gotten there yet. The idea is that some breast cancers are very sensitive to drugs. And we've been giving these drugs to decrease the larger cancer so then we can save the breast and do less surgery. But it turns out these drugs are so good, and I'm talking about mostly chemotherapy or other similar kinds of drugs, that they actually can destroy the cancer completely. So when you get around to surgery, there's actually nothing left. So the patients have been asking, why do I need surgery?
Good
I
question.
think it's a very good question. And so indeed, the question becomes, well, can I know that there's nothing left before I do the surgery? And that's where the sticky point is right now, because we've got to figure that out with mammograms, ultrasounds, MRIs, and now we're actually trying to do biopsies in those patients where we think there's nothing left to make sure we can pick up if there's anything left. And if there isn't, then ultimately we'll be able to avoid surgery in such patients.
That's remarkable. And in fact, the Jewish General Hospital is the first hospital in Canada to enroll a patient in a clinical trial, international clinical trial,
right,
to determine whether some breast cancer patients can actually completely avoid surgery. And I think you touched on the idea of how you would know if the cancer is actually completely eradicated.
Right. We do what we call imaging or x-rays, sophisticated x-rays, not only mammograms, but also ultrasounds and MRIs. And then if it passes certain criteria, well, then we do a biopsy of where the tumor used to be. And we know where the tumor used to be because these patients now, and in fact, every patient has a biopsy of the breast, gets a little clip, a metallic clip placed inside the breast. So even if the tumor is completely melted, that clip remains. And so we can aim for that clip and see if there's anything around there that is actually still residual cancer cells.
And so what does this mean, doctor, to people who are currently dealing with breast cancer?
Well, at the present time, we still have to operate, and we're not there yet because we've got to figure out that these tests are good enough to find the residual, the remaining cancer cells. And right now, we still have some work to do there. But nevertheless, we're heading that direction, and I suspect that in some time, we'll actually do a clinical trial where we might not operate patients that meet the criteria where there's actually nothing left, and we have a degree of certainty, let's say 90% and greater, that there's actually no cancer cell in the breast.
Can you say how close you are to that achievement?
There's some places in the States that are starting that. We've started our own trial, an international trial. The results are actually going to be presented soon. The biopsy perhaps was not quite as good as we thought. We weren't able to get all the cancer cells, but we're still working on some and understanding who exactly should get that biopsy, what criteria by X-ray should lead us to that test.
I'm sure you're making a lot of people very happy when you tell them this kind of news.
Yeah, again, it comes from the patients. I didn't invent this idea. The patients ask me, why do I need surgery? We give them this therapy and we see the tumor shrink until it disappears. We do an X-ray, we don't see it, so why do I need surgery? I think it's a very reasonable question, and we're trying our best to get there.
What was the reaction from your colleagues when you first came up with this?
That's a very good question. In fact, many of the surgeons thought it was a good idea. The medical oncologists were not so sure. So there was a bit of resistance, and it's not an idea that's completely accepted by everybody. You're totally right. Any new sort of conceptual change always meets some resistance, and this is no different.
But this could be paradigm shifting, if in fact.
Definitely can be, yes.
So if I understand correctly, you would give a patient chemotherapy. They would undergo chemotherapy, and then...
which they have to undergo anyway.
Regardless.
So we do it before the surgery, and then we see the reaction of the tumor. The tumor melts. Then if we run certain tests and we're good and we have a high degree of certainty and there's nothing left, then in the future we'll be able to avoid surgery altogether.
Whereas before you would, or I guess still now technically, because
now we do
trials,
it, yeah.
you would go in regardless.
Right. Now we still go in regardless. And in some cases, some kinds of breast cancer, half the time there's nothing left.
No kidding. So
that's a lot of surgery for nothing.
No kidding. Wow. As I said, I think you're making a lot of people happy with this kind of news.
So we hope that in the next few years we'll be able to move this forward and bring this to the patients in a definitive way.
In about a year's time, you figure?
I'm not so
hard
sure.
To say.
Hard to say still, yeah. Because we're going to have to follow these patients when we do the clinical trial, follow them for several years to make sure nothing happens in the breast, nothing comes back.
I see. I also mentioned, Doctor, in the introduction that you and your team have made a discovery that could open the door to new therapies for overcoming drug resistance, which is very important.
Yeah. In fact, one of the ideas of giving therapy, like chemotherapy, prior to surgery is that you can see exactly how the tumor responds. When it responds very well, that's fantastic, and the prognosis is really good. But when it doesn't respond completely or very well, then you're dealing with cells that are resistant to that therapy. And those are bad players, bad actors. So we've been analyzing pieces of tumor from these patients at surgery and finding some features of these cells and trying to identify what are the molecular changes, what are the changes within these cells so we can target them and kill these cells. So in fact, we recently found some particular changes in a subset of these kinds of patients, and we found it was really, really interesting. We found, in fact, that these cells were full of fat droplets, to our surprise. Now, why does a cell have all these fat droplets? We think that it's because it needs the extra energy to resist the therapy, the chemotherapy. So it sucks up all the fat, it keeps it in these droplets, and then it uses it to get all the energy from fat. There's, in fact, more energy in fat than there is from sugar. So that's how these cells are able to survive the therapy.
I see.
So it's something, the discovery that we made recently, and that's about to be published, in fact, next week or at the end of this week. And we're quite excited because it opens doors to therapeutic avenues.
How does one even go down this particular road to think this is a potential door that we could open?
Well, when a cancer cell becomes resistant to therapy, it expends energy to do that, and it creates vulnerabilities. It has to create new circuitry inside it, and that circuitry then is new and can be attacked because it's different from the circuitry that you see in normal cells that are not cancer cells. And so that is what we call a vulnerability. And in fact, what we found is that those fat droplets, fat cannot run free inside a cell. It's toxic to the cell. It's got to be packaged in these droplets. We were able to identify the protein that actually keeps these things packaged in little droplets. When we get rid of this protein, the fat leaks out and kills the cell.
It sounds like you're trying to put yourself out of work.
Yeah.
Which would be...
That would be a wonderful thing.
Wouldn't that be something?
Yeah.
I mean, we're being somewhat facetious, of course. Nevertheless, it must give you a tremendous amount of satisfaction to know that you are working on this kind of work that impacts the lives of so many people, their families, their friends, extended family, and so on. Can you begin to describe what it's like to have that kind of an effect on so many people?
No, in fact, one of the beautiful things about the kind of research that I do is that it's very much related to the patients. We ask routinely for patients to donate the tumors that they have at surgery for research, and we work on that. And we sometimes put them into mice, we sometimes grow them, and we can find new therapies. It's really interesting because in my lab, people are really aware of that, have a real concern for the patients that they are actually working on, whose tumors they're working on. So it's really a beautiful thing.
People wonder about cures and things like that, which is obviously the ultimate goal.
Right.
But, it takes, obviously it's an evolutionary process. It takes steps to hopefully get to that point.
Right, of course. And we're happy to add our contribution, in fact, both from removing myself from surgery in some cases, but I think the contribution of understanding drug resistance will be ultimately also very fundamental, because that is why patients ultimately die of cancer. We give them therapies, and they become resistant to therapies. If we can understand the mechanisms of this resistance, that's how we can overcome, we can cure cancer, or at least prolong significantly patients that have cancer and turn it into a chronic disease, maybe.
And kudos to the patients who suggested this. Maybe just a final word on their incredible suggestion to you.
I think we have to really listen to our patients and listen to their ideas. And sometimes they're a bit off the wall, but I think we have to follow them. But not only that, I'd really like to thank all the patients that contribute their tissues and their blood samples for research, because without them, we can't go forward.
Doctor, thank you.
You're welcome. It's a pleasure.
Really appreciate your time. That is Dr. Mark Basik, a surgical oncologist and medical director of the Interdisciplinary Breast Cancer Team at the Segal Cancer Centre at the Jewish General Hospital and senior investigator at the Lady Davis Institute. That's the research arm of the Jewish General Hospital, member of CIUSSS West Central Montreal. And that's it for this edition of Your Health. Thank you for your time. To hear our previous programs, you could find them at podcast.ciusswestcentral.ca. That's podcast.ciusswestcentral.ca. And let us know if there's a topic you would like us to explore in the future. I'm Barry Morgan. Until next time.
You've been listening to Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.